Alright guys, Dr. Marquez here along with Dr. Vakian. Recently I've been suffering with some carpal tunnel. Pretty bad, where every night my hands are falling asleep. When I'm at the computer, my fingers start tingling. Enough to wake me up at night and enough for it to be a pain in the butt. I've been stretching a bunch at home and doesn't really seem like it's doing much. A few months ago I took a steroid pack from one of our doctors and that relieved it for a little bit, but as soon as it wore off it came back. I had Dr. Vakian work on him, and the first day I already felt a relief. And what I'm thinking it's coming from is these muscles in my forearm, whether the flexors and the extensors, they're getting too tight and they're knotting up and putting pressure on that wrist, which causes the tingling. Lately I've been doing a lot of judo and jiu-jitsu and using my hands, and I think I'm just overusing it. But I don't want to stop what I'm doing, so Dr. Vakian here is going to loosen it all up and allow me to continue to just do the things I want to do. We did one treatment and I immediately felt a difference. I think it's going to take us probably 2 or 3 weeks to get a change where I don't have to worry about it as much. So I'm going to let her just do her thing. I'll try to explain what she's doing along the way. If you're at home and you're suffering from some carpal tunnel, make sure you give us a call. This stuff works, and it's a way to fix the problem.
Okay. This one first. Squeeze your pinky and thumb together. Hold them tight. Okay. And turn your hand up. Squeeze again.
So what she's doing is some muscle tests on my hands, and I'm trying to hold my pinky and my thumb together. And when she goes to pull them apart, I can't hold it because it's so weak. So she's going to try to correct that.
So face up, squeeze pinky and thumb again. Better. Open and down, same thing. A little better, but not perfect. Go ahead and stand up for a second. Turn the spine up. There you go. Relax. Sit back down.
So what she did there, she manipulated my elbow just to try to break up some scar tissue and get a little more movement in there.
Squeeze pinky and thumb again. Get in there. So now work on your pronator muscle.
So I'm going to be honest here, she's putting some pressure on my pronator muscle or my forearm muscle, and it hurts because there's some spasms there, and it shouldn't hurt. But she's going to get in there, try to loosen that muscle up to give me some more range of motion on that joint.
So I'm going to squeeze and you rotate.
So now I'm rotating my hand while she squeezes it to try to pin that muscle down, and we're going to stretch it to break up the scar tissue, break up the spasms, to give me some more range of motion in my wrist.
Okay. Squeeze again.
A little better.
Face up. Squeeze. That one's good.
So you may wonder why she's working on the muscles here when my carpal tunnel is down here. Remember, all these muscles flex and then runs into that joint there to make it move. So if we loosen here, this joint will work better. I'm not going to lie to you, this is uncomfortable, but a little bit of being uncomfortable will far outweigh me not being able to sleep tonight.
Okay, let's try it again. Open. Now squeeze.
That's better.
That's much better.
So what we did is a muscle test there, and this time where in the beginning I couldn't hold those fingers together Now, after getting these muscles to function correctly, I can hold those fingers together. Now we're going to do the other side.
Face up, open, close. That one's not so bad. And face down, squeeze. That's all there for.
Yeah.
So when I check the face up, I'm checking more wrist stuff.
Okay.
And when we check face down, it's all this lovely forearm scar tissue.
So I was in the gym the other day
Lots
doing
of work
arms,
out.
and I was just working my forearm, which I probably shouldn't have, because now she has to work on it. Right there.
That one travel?
Yep. So what we're doing now is just taking care of the biomechanical approach to this whole thing. You know, I took the steroid earlier just to make myself feel better and get the inflammation down, but it did nothing for the mechanics.
Okay. Open and squeeze again. Much better. And you're right-handed.
All right, so if any of you guys are out there suffering from carpal tunnel, make sure you give us a call at Back Pain Relief Center. Dr. Vakian is great at this stuff. I have her work on me all the time. No reason to continue to suffer through this carpal tunnel stuff. There is a solution to make you function and feel better. Hope to see you soon.